Good morning, everyone. My name is Dana Mannheim, and I'm a candidate for the Master of Public Health at Purdue University. I appreciate you all being here today, and will be presenting a summary and analysis of my culminating experience that was conducted in Cleveland, Ohio. During my presentation, I will plan to cover an introduction of my agency, ACE Sports Psychiatry, provide an overview of each project, my individual responsibilities within that project, and project outcomes. I will then share lessons I have learned from my experience, provide a personal reflection of my experience and how they relate to the core competencies of public health, and close out the presentation with my acknowledgments and open up the floor for any questions. I completed my practicum at ACE Sports Psychiatry located in Beechwood, Ohio. My preceptor was Dr. Mayur Pandya, a board-certified physician who specializes in diagnosis and management of behavioral and neuropsychiatric conditions. His expertise is in mood and anxiety disorders, behavioral manifestations of concussions, and neurodegenerative diseases. The mission of the organization is to deliver high-quality mental health care and management to proactively identify conditions, provide timely access to services to maximize health, improve organizational performance, and achieve team goals and success. The target population for his practice includes elite athletes, ranging from professional athletic organizations to high school organizations, as well as sports professionals like coaches, front office staff, trainers, etc. My practicum was centralized around analyzing mental health in elite athletes from three unique research perspectives. The first perspective we were seeking to address was the environment. The first project sought to analyze how environmental factors and determinants influence athlete mental health treatment-seeking behavior. The second perspective we analyzed was the influence the elite athlete lifestyle had on the significant other's quality of life and how this impacted his or her mental health. Finally, the last perspective we analyzed was through the lens of the individual athlete, specifically examining cultural barriers. We sought to identify what these cultural barriers were and how they influence individual perspectives of mental health treatment seeking. The first project was conducted alongside Dr. Pandya to analyze environmental barriers that influence player treatment-seeking behavior. I began this project by conducting a literature review of all the existing research pertaining to this population, and then presented this to Dr. Pandya. I then created a PowerPoint deck that was designed to be presented by non-mental health professionals so it could be delivered to organizations on a universal basis. It was important here to take into account the audience for relevant messaging. I then created a script to be a talk track for the individual delivering the presentation to help overcome lack of knowledge or lack of preparation for the presenter. Once Dr. Pandya approved the deck, we leveraged his network to disperse the PowerPoint to his physician colleagues for their initial feedback. We also decided to send the deck to a few coaches for their perspective on the relevancy of this material. I then compiled all the data from the Google survey via Excel and created a holistic summary for Dr. Pandya. This slide depicts a few of the project outcomes. Based on the feedback we received from both the coaches and the physicians, we felt that a few modifications were needed for more successful content to improve the mental health knowledge as it relates to this population. However, we did feel the comfort level this sample of coaches felt delivering the presentation was sufficient. Moving forward, Dr. Pandya will implement this feedback, tweak the presentation to include more relevant content, and send this off to a larger network of coaches he worked with to be delivered. My second project sought to analyze how the quality of life for significant others of elite athletes was impacted by the lifestyle of athletics, and how this in turn impacted their mental health. My responsibilities for this project were first completing a literature review, then leveraging this research to design and create a survey that would be dispersed to my network of coaches' significant others to understand firsthand perspectives of this research topic. I used the SurveyMonkey tool to create a 10-question survey that posed questions relating to the extent of how elite athletics career impacted their livelihood. What aspects of the relationship were affected? If the organization of the significant other offered any mental health services, and what improvements they would like to see to improve access to mental health. I then drafted an email and dispersed this survey to 17 recipients. Finally, I compiled the data into an Excel spreadsheet to present to Dr. Pandya, similar to what is shown on this slide, to create my educational pamphlet. Based on the feedback I received, I created a 2-page educational pamphlet to be distributed to the project participants. The purpose of this pamphlet was to serve as a quick reference guide for significant others to find mental health resources both inside and outside the athlete's organization. I also provided a list of vetted mobile apps as a means to help improve mental health status, and sample talk tracks and situational examples of how to seek mental health treatment inside and outside the organization. Finally, my third project honed in on the individual elite athlete and identified barriers to mental health treatment seeking, specifically through the lens of cultural determinants. In order to accomplish this, I conducted a literature review and summarized that information to create an educational deck to be leveraged by Dr. Pandya for his future organizational presentations and individual treatment sessions. The presentation included a history of healthcare and systemic racism, identified risk and protective factors, explained existing cultural barriers that are prevalent today, provided examples of successful available treatment approaches, and provided recommendations on how this could impact future research. Based on this information, I created a bank of resources that could be accessed by the elite athlete population that also aligned with overcoming the cultural barriers I identified in my research. I had to ensure this communication was culturally appropriate and palatable for this population. Dr. Pandya will continue to build out this deck and deliver it to players at the beginning of the new season. Throughout this practicum, I learned a lot about the field of public health. Specifically, I was able to develop a much more practical understanding of the dynamic between two historically siloed fields of health, mental health and public health. I was also able to leverage the core competencies of public health to enhance my learning experience. I was able to identify the importance of evidence-based approaches to public health in order to achieve timely program design, execution, and evaluation. This competency is imperative for data validity and accuracy and to legitimize your research within the field. Finally, I was able to understand the interplay between this competency and the dependency on technology, like Excel, SurveyMonkey, and G Suite, as a means to showcase the data that I consolidated. Planning and management are also two essential components to promote public health. In order to be efficient with your resources, you must identify available resources and gaps to validate the need for your program. It is also imperative to ensure content in the program is culturally relevant and to be open to evaluate your program for success and future sustainability. Throughout my experience, I began to understand that systemic change would be more likely to be enacted with policy change. This is one of the most effective ways to implement community-level change for public health issues. In order to accomplish this, it is necessary to determine the proper stakeholders and articulate the mission and explain why it is important for them personally. Leadership and communication are also two important components of successful public health delivery. Leaders inspire the vision for the project, and without leadership, the previously mentioned competencies would not be able to be executed. Communication is the underlying key to teamwork and program execution. With that, it is critical to be respectful of people's time to ensure communication isn't tailored to be relevant for the individual. Finally, to contextualize the concepts I discussed in the last slide, I was able to leverage those competencies into experiential lessons I will be able to take away from this practicum. The first lesson I learned related to the program design and execution. The project would have been more successful if I had created a more structured and built-out project plan. These 3 projects were a lot of work, and time is a valuable resource. Had I accurately understood the effort each project would require, I would have been more effective in budgeting my time and not so stressed out about hitting deadlines and deliverables. Second, I was able to understand the importance of a professional network. Dr. Pandya was able to leverage the network from his time in medical school for feedback on our first project. I was able to leverage my professional network for feedback on my second project. Each individual within your organization and network can provide a unique perspective, so it is important to not overlook the talents and backgrounds of each individual person. Third, I learned how to improve my communication. I now understand the importance of culturally relevant messaging for the success of a program. I also deepened my understanding with inter-team communication and how being transparent creates trust and efficiency for program execution. Finally, I learned that the interplay between teams, organizations, and professions is critical for the most successful program design, outcomes, and sustainability. There are a variety of unique perspectives different entities can bring to the table, and the most successful programs I evaluated throughout my time took advantage of that approach. I would now like to take this time to thank everyone who helped see this project through to the finish line. I would first like to offer a special thanks to the Purdue faculty and administrative staff, and my peers who supported me during this practicum. I'd now like to offer a thanks to Dr. Pandya for all his effort and guidance throughout this practicum, and a special thanks to my husband Dan for his love and support. Finally, I'd like to offer a very special thank you to Dr. Amal for helping me to identify my practicum site that really aligned with my interests, and Dr. Abul Anain for his guidance, assistance, and feedback throughout this entire engagement. Thank you all for your attention here today, and please let me know if you have any questions.